So we've had a great working relationship with Northeast Delta Dental for many, many years. And as always, they step to the front when there's a breach, when there's a concern, when there's a need, and they stay in tune what's going on in our community. And this last year was a particularly difficult one for many of the largest federally qualified health centers in our state. Between the compounding impacts of the pandemic, workforce shortages, changes to our 340B reimbursement programs, losses of grants that were there to help sustain people through the pandemic, having to recruit and retain agency staff, all of us were really struggling to kind of stay afloat during this time frame. And we reached out. We reached out to our community partners and said, it's been a tough year. We'd really be grateful if you'd be willing to step in and help us continue to be here, continue to exist, continue to support this community. We're a safety net provider, and our goal is to be here when people are in their time of greatest need. Federally qualified health centers, they're able to look at the whole family. They're treating that individual patient and all of the things that are going on for that person, whether it's their social circumstances, their financial challenges, housing related issues, mental health related issues, and who didn't have some mental health problems after the pandemic, because let's face it, it really took all of us and put us in a pressure cooker situation. And it's just really nice to live in a state where we are fortunate to have those relationships and to have organizations that understand the importance of that safety net and that infrastructure and are willing to step up when there's a struggle. So thank you, appreciate it.
On behalf of Ammonoosuc Community Health Services staff, board of directors, and patients, I am grateful for the investment of Northeast Delta Dental into our mission. In northern New Hampshire, we provide high-quality care to 1 in 3 of our friends, family, and neighbors. That care is nationally recognized for outcomes in depression, diabetes, and colorectal cancer screening. We couldn't ask for a better collaborative partner and investor than Northeast Delta Dental. Thank you.
Health centers have historically existed to serve those folks that experience barriers to care. Typically, that has been folks without insurance, folks with inadequate insurance, and folks on Medicaid. We're able to do so by having a reimbursement rate that is sufficient to cover not only the cost of the direct care, but of the important wraparound services. We're very pleased to see that big gap in reimbursement has been closed significantly with the recent rate changes in the state of New Hampshire. And we're very grateful for our community partners who have chosen to invest in us to assure that these services are sustained without interruption to the communities that depend on us. Thank you.
So when you support your community health center, certainly you're helping us provide dental, medical, and behavioral health support to our families and people in your community. But it often goes much more than that. With our wraparound services, we're able to address the whole person. For example, just recently, we had a mother who was a family of 4. She was a dental patient. She needed dentures, full set, top and bottom, but she just really couldn't afford to do that. But from community support, we were able to make that happen for that woman. Now, she came back later to us and told us, I was able to get a job, and she attributed it to the fact that she had these beautiful new teeth. But when we were talking to her, we kind of found out she had some other challenges going on. So she had this new job, but she was having transportation issues trying to get there. So from community support, we were able to buy some gas cards to kind of bridge her so that she could get to that job until she got her financial footing a little bit better. But then there were really actually a couple of other things. They had just found out that their rent was going up. They weren't going to be able to afford it. So our social workers, working with our community partners, were able to find adequate housing for them at a rate they could afford. Now, this is a huge issue in New Hampshire and all over the country. Very hard to deal with. We were able to make that happen. There was one other thing we did for her. They had a little bit of food insecurity challenges, so we have an on-site WIC service. So we were able to help them with their, kind of supplement their nutritional needs. So yes, medical, dental, behavioral health, but we're able to actually help that whole person at a community health center and really address those things that impact their quality of life as well as their health status. And I just want to thank you so much for doing that for us.
Hi, I'm Tom Raffio, CEO of Northeast Delta Dental, where we believe everybody deserves a healthy smile. And part of that requires creative solutions to address underserved populations in New Hampshire. So I, for one, and the company as a whole, my board of directors and management team, we really appreciate the work of all of the federally qualified health centers in New Hampshire, which is why we made a recent significant donation to all of them to help with creative solutions to address underserved populations in New Hampshire. My advice for everybody is look for these creative solutions, partner with your federally qualified health centers in order to reach everybody in New Hampshire, because everybody deserves a healthy smile and everybody deserves access to quality health care.